Thank you for watching GTV Breakfast. My name is Kafui Day, and today on the BFS Clinic, we're looking at silent glands, loud impact. It's all about thyroids today, and my guest is very familiar with thyroids. He is an otolaryngologist with the West Africa Institute for Special Surgery, WAISS. His name is Dr. Kofi Boahene. Good to have you on the show. Good morning.
Thank you. Good morning.
All right. First of all, what is a thyroid? And what role does it play in the body? You know them very well.
Yes. The thyroid, we call it, it's a master gland. It's a very, very important gland. It sits in front of your neck, right? And so some people, you look at them and say, I can tell you have a big thyroid. The gland makes an important hormone called the thyroid hormone. Behind the thyroid gland are some smaller glands we call the parathyroids. They regulate calcium in your body, right? So today, really, we are focusing on the bigger gland, the thyroid. We only have one thyroid, but it has two aspects to it. One on the left, one on the right, fused in the middle. So we have what we call the right thyroid lobe and the left thyroid lobe, and then there's one connector that goes across your neck from one side to the other.
Okay.
So that's the thyroid gland.
You said earlier that it regulates calcium in the body?
So behind the thyroid are a second gland called the parathyroid.
Okay.
Para from both sides, right? Sometimes you normally have 4 of them. In some people, they have more than 4. But that regulates the calcium.
Okay.
So you can have a problem with the thyroid itself, which is what we're talking about, but you can also have a problem with the parathyroid.
Okay.
Yeah.
When you say it's a master gland, what do you mean?
If your thyroid hormone is off the chart, too high, you behave in a manic manner.
What is a manic manner?
Like everything needs to happen now. Your speech is high. Your heart is beating fast.
Really?
Yeah, everything feels you're very hot. Yeah. So it regulates reactions in the body.
Okay.
Right? So things move sort of like faster. If your thyroid is very low, everything is dull. I'm simplifying, but you can think about it that way. Your body's metabolism slows down. You gain weight without knowing where the weight came from, right? You don't want to do anything. The room is cold when everybody feels fine. So those are the 2 extremes, right? So that sort of gives you a gist. It regulates the body's metabolism.
So are the technical terms hyperthyroidism and hypo?
Yes. So if your thyroid function is fine and the hormone levels is normal, we call you a euthyroid. Euthyroid. If it's low, it's a hypothyroid, and then you have hypothyroidism. If it's high, it's a hyperthyroid, and you have hyperthyroidism.
Okay. Are these the only, from the hypo and the hyper, are there other disorders connected to the thyroid that we should be aware of?
Those are the broad names, but the thyroid can have diseases that makes them hyperthyroid, hypothyroid, and so it can have cancer in it, they have nodules. So we always have to sort them out. We always start from the function of the gland. We take some blood tests and see what is happening, and then from there we can deduce what's going on. Then we look at the glands either with an ultrasound or a CT scan and look at it and see what's going on with it and what do we have to do.
What are some of the red flags that somebody watching this show should be aware of, which will make them think, maybe there'll be something happening with my thyroid?
Okay. So everybody, you're in a room, everybody is fine. Then you take your clothes off, right?
It's not bipolar?
It's getting hot in here.
Oh, it's getting hot. It's getting hot. You know that song?
I do.
Nelly.
And he said, you ask your friends, isn't it too hot? Everybody says, no, it's fine, right?
Uh-oh.
They said something with your metabolism is off.
Okay.
So that's a tip off, right? You are gaining weight without, I'm doing my regular activities. I walk, I work. But I'm gaining weight. It's unusual. Something is off. Or my hair's falling off. My skin doesn't look right.
Your hair can fall off?
From hyperthyroidism, it can. My skin doesn't look, I'm losing a lot of weight. I eat a lot, but I'm losing a lot of weight. Things like that will tip you off. Sometimes it's visible. There's a lump on my neck, right? One side looks different from the other, or all the neck looks bigger. Your thyroid sits in front of your swallowing tube, your breathing tube. I'm having difficulties breathing, Like when I take a breath, it doesn't feel right. It's as if there's something really stuck in my neck. That's a tip-off.
Are certain groups more prone to thyroid issues? Let's say maybe women or older adults.
Not necessarily. The longer you live, the more you accumulate injury into your thyroid. So you may have some thyroid cancers that we tend to see. But there are some areas that are thyroid diseases can be endemic. The thyroid requires some type of ions to work very well. So if you are in a place that the salt that you eat has not been properly processed,
Iodinated.
Iodinated,
Okay.
then your thyroid has to kind of overact and it gets big, you get a big goiter. So if you are in a place that that's what they do, you may see one family, two families having it. But there are some syndromes. When we say syndromes, disease forms that you get a thyroid disease, you get this put together. That can run in families.
Okay.
Yeah.
Sometimes you see people with like big lumps.
Yes.
Considerable.
Yes.
Around, under their chin, around on the neck there. Is that a thyroid?
That's a thyroid.
Happening?
That's a thyroid. That common name we call it is a goiter. Goiter. It's a benign thyroid problem, but the thyroid is huge, and the reason why it gets to that size is that it wasn't causing any other problems for them, so they live with it, or it becomes too big and it's unsightly, then they seek care, right? You would never see that type of big goiters in the US because of the way the healthcare system is. You go in, you get care. But here, some people will let it go because it may be financial, and so they don't get it done. And they only seek help when it starts causing problems.
Okay. Meaning
pushing on your throat so you can breathe. When you lie down, everything feels like you're choking, or you can't swallow because they're too big.
What's causing that huge growth?
And so, for example, if you don't have iodinated salt and your gland has to overact, then it becomes hyperplastic. It just gets big.
Traditionally, in the past, how have thyroid cases been diagnosed in Ghana?
In Ghana, so usually the main thing is an exam. You take a feel of the neck and you can see, oh, it's bigger than normal.
But not all thyroid conditions will give you a goiter, right?
No. There are different. There are some that are cancers that are very small, and you wouldn't know. And the only reason why they found it is that somebody was checking something in your neck and they saw it on an imaging. So some are small. The goiter is obvious; it's big, so you can see it. Yeah.
So that was the old way.
So you take a feel and you know there's something there,
right.
and after that you do an ultrasound. You just use an ultrasound. Ultrasounds are not as expensive as MRI, so we have them around. They look and then they can see a lump in it, and then if you cannot make a clinical diagnosis, this looks benign, then you stick a needle in it, take a piece of it.
It doesn't pop?
Oh no, a tiny little needle.
Okay.
Yeah, it will pop if it's a cyst. A cyst meaning it's a fluid-filled space in the thyroid. Then if you put your needle in, you can pop it.
So there's no fluid in that
those are irregularly. No.
Okay. So when you determine it's a thyroid and then you treat it, in the old days, how were they treating?
So you can use medication. So if you give the right medication, the thyroid thinks it needs to make all these hormones. If you give them the medication, then they can suppress it. Okay. Sometimes they used to give radiation to shrink it, and down the line the radiation can cause problems. But by and far, the treatment has always been, if it's too big and it's causing problems, you use surgery to take it out.
Okay. Will there be like a mark left?
Yes. Yeah. So that's why we're talking about other means of treating it without surgery. We can get into it. But to do a thyroid surgery, you make an incision in the lower neck, and then you lift the skin, and then you go to the thyroid, and you carefully peel the thyroid from the nerve that allows you to speak. The nerves that allow you to speak sits right underneath the thyroid. So anybody doing this surgery needs to know what they're
Wrong move, and we can't talk again.
Then you can talk. You can talk, but
it will not be the same quality.
It won't be the same. Yeah.
Okay.
So then we take the thyroid out. If we take all the thyroid out, the thyroid is important, so you can't just live without it. Then we have to give you medications that give you the thyroid medication by mouth.
Can one live on half a thyroid?
Yes.
Okay, but you have to take medications to supplement?
Not necessarily. So if the half thyroid is functioning and give you the correct levels that we check with blood work, then you don't need medication. But if it's low, then we supplement it.
How big is the thyroid?
A normal thyroid could be like the size of a thumb on both
Oh,
sides.
okay,
Yeah.
it's quite substantial.
Yeah, it's not too small.
Let's talk about the new techniques that you're using here to deal with thyroid issues.
So as we said in the beginning, we like non-invasive ways of treating things, things that we don't have to cut and make big openings, right? So radiofrequency ablation of thyroid is something that is really becoming a big option for treating thyroid nodules. So if we find a lump in your thyroid and we see it early, and you don't wait for it to become that big unsightly goiter, then we can, in the office setting, put medication to numb your neck. Then we use the ultrasound to see exactly where the thyroid nodule is. Then we stick a needle, a special kind of needle, that is connected to a machine, that is a generator, and generates radio frequency that ablates it. So it shrinks it. It may not take it away 100%, but it will shrink it about 70, 80%, and then we don't have to take your thyroid out. So there's no scar involved. Yeah. The reason why I'm so excited about it for Ghana and the West Africa region is that when we do surgery on black skin, we are prone to keloids. A keloid is a scar that just keeps growing.
Those raised bumps around the back of your neck.
Correct. If you imagine you have it on your neck, and it's from a slash of a surgeon, not too good. Okay, so if you have a thyroid nodule that is not massive, the massive one we don't tend to like to treat because we will spend the whole day zapping it. Anything 2 centimeters, 4 centimeters, 6 centimeters, we can use this probe and then get it to shrink. I think we are probably the only people offering it in West Africa. I will bet that we are the only people offering in the Southern Sahara, Sub-Saharan Africa, and there might be just 1 or 2 places on the continent doing this.
Good job.
Yes.
This RFA technology, this treatment mode, can you use it for benign and malignant tumors?
Very good question. It started off with benign, so the experience has been accumulated more for benign tumors. It can be used for cancers. Okay. Yes. So I use the word cancer, not necessarily malignant. It's a cancer. If it hasn't spread to other parts of the body and it's just contained in the thyroid, you can. So there's increasing information on how to treat those cancers with the radiofrequency ablation. I would not offer that. We would not offer that at WAISS yet, because we always want to know what we are treating, right? And we want to be able to follow it up closely. When we get to the point that we are able to just take a piece, give to our pathologist, and be able to follow things closely, we would offer that. For now, we are starting with the benign nodules that you don't want to be cut for. And then the other thing with taking your thyroid lobe off is if we take it off, we may have to put you on medication the rest of your life. With the ablation, when we do and shrink it, we leave the normal function thyroid behind. So most likely you don't need any medication.
Probably it kind of segues into my next question, which is about comparison. How do you compare the radiofrequency ablation method to the traditional ways of dealing with a thyroid in terms of cost, recovery time, and maybe even side effects?
Okay, so the surgery, the cost of surgery is you have to undergo general anesthesia, have an incision, recover from the surgery, have a scar that you live with it the rest of life. It's still a very, very good option. We do it very well. People recover very well. Okay, with the radiofrequency, this is done without general anesthesia.
What does that mean?
You don't have to be put to sleep. Okay, it's an office procedure. We numb the area up with an injection, and then we do the ultrasound, and then we...
So you are conscious and you're
wide awake.
Okay.
Yeah, we can talk to you.
Okay. Yeah. Listen to music, whatever.
Listen to music, what you do. So as soon as you're done, you get up and go home. Okay. So there's a shorter downtime. Okay. Technology-wise, we have to get a probe. The needle is not like this simple. That's probably the most expensive portion of the surgery. In general, it's cheaper than doing the open surgery just because of the components that are involved.
Is this a one-time procedure, or you have to come back again and do stuff again and again and again?
That's a very good question. So if you come in with a smaller nodule, we catch it early, one certain procedure may be all we need. Okay. If it's slightly bigger, we don't want to put too much energy at one time to affect surrounding structures. So we will treat it and then wait and see how it resolves, or the result in about 3 to 6 months. And if it doesn't shrink enough, then we can treat it again. Yeah.
Tell me about some of those really successful thyroid cases that you've worked on that have really radically transformed the person.
Well, I can think of a lady about 79 years old that we did here. Her son is a physician in the US, and she went on the WhatsApp group and says, can I find a thyroid surgeon in Ghana? And someone said, come to WAISS. And the concern was that she's 79, how's she going to do? Her problem was that whenever she lies down, she couldn't breathe at night.
Because the goiter, right?
Yes, yes. And we did it. It took about 45 minutes. She went home the next day, doing great. So that's a big success.
Did the goiter disappear over
completely
in that short time?
Yes.
What was the look on her face when she looked at her face?
Now I'm one of her grandsons.
Automatic
so that
absorption into the family.
Yes, that's it.
She's over the moon.
I can get fufu anytime I go.
One time. Good side benefits.
Yes.
Yeah. Before you give some tips to the viewers on thyroid care, and I just want you to spend a few minutes to talk about the West Africa Institute for Special Surgery. And you said earlier that you're probably the first people in this continent to be doing this kind of thing. What does that mean to you?
Yeah, maybe not the continent, because I don't know what people are doing, but I did search, and I could see there are no thyroid RFA centers.
What does that mean?
It's good to be a leader in healthcare, right? And that's what we want this place to represent. We are bringing expertise that is world class. We are bringing technology that is cutting edge, and to be able to offer a minimally invasive treatment to people who actually will benefit a lot, because scar in dark skin makes us very proud.
People are even afraid of knives, so
yes.
When they know that it's not going to be using knives. Where do you see this going?
So we want to be able to kind of train people and make this become a norm in Ghana and West Africa, that it becomes a choice that patients have. Whether you are offered surgery or non-surgical treatment, it will become like not a big deal. And people Google to look out for us because they are looking for a place that gives RFA. And before we started this place, there were no options. Now they do have options.
Good job.
Thank you very much.
Is it possible to have like some tips on thyroid care? How do I take care of my thyroid? I don't see it, but if it's a master gland, I better take care of it.
The main thing, if you feel a lump on it, have someone check it, right? Let it properly be checked so that they can define whether it's a benign or a cancerous lesion, so they take care of it very well. You can exercise the thyroid. You can eat healthy. Okay. You can avoid smoking. We don't know what causes thyroid cancers. We sort of do, some of them run in families. But that's about as much as you can do. The main thing is, if you feel a lump in your neck that's not going away, have it checked.
And then if I'm feeling
out of the norm, too hot, losing your hair, losing weight without any good explanation, seek care.
All right. Well, thank you so much.
Thank you very much.
I've enjoyed this conversation.
Same here.
Very educative and insightful. Dr. Kofi Boahene is an ear, nose, and throat doctor, otolaryngologist at the West Africa Institute for Special Surgery, WAISS. My name is Kafui. I hope the conversation made you wiser as far as thyroid issues are concerned. Stick around. This is GTV Breakfast. We'll be right back.